Many people believe that getting cancer is purely down to genes, fate, or just bad luck. But through scientific research, we know that our risk actually depends on a combination of our environment and aspects of our life, many of which we can control. So our group decided to spread cancer awareness and convey the message that prevention is better than cure. So we went around college to find out how much does the students know about cancer.
So what is cancer?
Cancer is like something you have like tumor and stuff in your brain. Anywhere you can be part of cancer. So cancer can grow anywhere part of your body.
Cancer is basically a disease where your cells multiply uncontrollably. Eventually you will develop a tumor and die. Oh, okay.
Basically, I just know that it is a disease. Yeah,
That's
all I know.
That's all?
Yeah, it's
Okay,
a disease.
okay.
Yeah, there's a lot of type of cancer, lung cancer, breast cancer, all sorts of cancer.
No. Any knowledge about cancer?
I only know breast cancer.
Okay.
Okay, so now we're going to meet with the oncologist. Her name is Dr. Krishna Lai. So we're in Sunway Medical Center as well. Okay, now let's go meet her. Hi, doctor. Hi, doctor.
Hello.
So, would you like to introduce yourself first?
Okay, sure. I'm Dr. Christina Lai. I'm a clinical oncologist. That means I'm a cancer specialist. I basically treat cancer patients with chemotherapy, targeted therapy, or even radiotherapy as well.
So how long have you been in this?
In this field, well, it's about 10 years now that
Wow.
I've been an oncologist. Yeah.
Okay. So let us ask you a few questions regarding on cancer.
Okay.
So what is cancer actually?
Okay. Well, basically, cancer is a disease, okay, where a patient gets uncontrolled growth of a cancerous cell. So normally, a cancer starts with one cell that has become cancerous. That means its growth is unregulated. Something happened in the DNA or a mutation happened, and it just starts growing uncontrollably. All right. So it starts dividing, and it becomes a growth. And then it starts growing, and then starts spreading elsewhere. So generally, that's the general concept of cancer.
Okay, so is there like anything cure to cancer?
Okay. Well, it depends on the type of cancer. Now, that's why it's very important that you're doing this cancer awareness thing, because a lot of type of cancers, if it's detected early enough, possibility of a cure is very real. Okay. For example, breast cancer, colon cancer. So if it is detected early enough, it can be operated on, and the whole cancerous growth can be removed, and the patient can be cured.
Oh, okay. So do people come in, like which stage do people come in that they know that they have cancer, like stage 1 and stage?
Okay. Well, unfortunately, in Malaysia, a lot of patients present quite late in the illness. Now, we keep coming back to breast cancer because it is one of the most common cancer in women. With breast cancer, it's very easy for a woman to find a lump in her breast, and then she sees a doctor about it. So that is a good chance of it being detected early enough. But if you say, for example, lung cancer, a lot of people would have a cough, and they think it's a normal infection. They go to see a GP multiple times, given multiple courses of antibiotics, and it still doesn't go away. And usually, after a long time, the symptoms do not improve. They go and see for a second opinion to get a chest X-ray, and that's when they found the growth. And by then, it can be too late. So it's just creating that awareness that people, have awareness that they probably need to think, get a second opinion early on, or maybe ask for a chest X-ray or something like that. Yeah.
Okay. So what are the rare types of cancer that people aren't normally aware of?
Well, okay. Or maybe it's easy to say what are the common cancers that people most people are aware of. Obviously, the big cancers are the breast cancer, lung cancer, colon cancer, right? And of course, the more rare people don't hear so much are cancer of the head and neck, for example, of the nasopharynx, okay, of the voice box. They are not so rare, but probably not as you hear so often. And perhaps the less common ones like kidney cancer, bladder cancer, they are perhaps not so common compared to what I've mentioned earlier on.
Oh, okay. So are there significant ways to prevent cancer?
Now, in the more common types of cancer, there are ways we can reduce the risk. So, for example, lung cancer, everyone knows smoking is a real risk factor, right? So, stopping smoking, don't pick up smoking at all. Or even for colon cancer, for reducing your risk, reduce the amount of red meat you take. So, for certain types of cancer, yes, there are things you can do to change your lifestyle to reduce your risk. But there are some that, unfortunately, we don't even know what are the risk factors, so we don't quite know what are the ways to reduce things. But there are certain types, for example, smoking, diet, okay, weight, control your weight, and these are the well-known ones. Yeah.
Oh, okay. So basically, living healthy is
Absolutely,
the
yes.
way
Yeah,
to
absolutely,
prevent
yeah.
cancer. Okay. Thank you so much for your time, doctor.
Okay, you're welcome.
Thank you.
Okay, hi. So, do you think prevention and early detection for cancer is important?
Yes, I do think it is important because it saves lives. I mean, especially when you have like the first stage or second stage of cancer, it is very curable. But when you're in third and fourth stage, it's too late.
Okay.
Yes, it's very important.
Yes, I do think it's very important because time makes a very big difference and there's a big gap between stage 1 and stage 4. So I think early detection is very important.
Because prevention is better than cure. And when you get cancer, you have to pay that amount of money to get cured. And when you get it, the risk of getting cured is low, and the chance of getting cured is low.
Okay.
So yeah.
So, since all the students that we interview had agreed that prevention and early detection is important, we asked them what would they do
What
to prevent
measurements would
cancer.
you yourself take in order to prevent cancer?
Well, I guess when I'm 21, I would go for a breast checkup
Okay.
or a mammogram. I mean, visit your gynecologist or anything, and they would easily do it for you.
Okay.
Well, I will first exercise regularly and eat healthy food because I believe these two are important in preventing cancer.
First, I will exercise and keep fit. I
Okay.
will eat healthy meals
Okay.
and stay away from carcinogens and radiations. Eat your fruits and vegetables.
Okay. So, so obviously you yourself practice that, yes?
Yes.
There is more than 8.2 million of cancer deaths in 2012 worldwide. According to Cancer Research UK, 4 in 10 UK cases of cancer can be prevented, largely through lifestyle changes. Smoking is the most important preventable cause of cancer in the world. Smoking increases the risk of at least 14 cancers: cancer of the lung, voice box, esophagus, mouth, upper throat, bladder, pancreas, kidney, liver, stomach, bowel, cervix, ovary, nose, and also sinus. It causes over a quarter of cancer deaths in the UK and nearly 1 in 5 cancer cases. More than 4 in 5 UK lung cancers are caused by smoking. The World Health Organization says that overweight and obesity are the most important known avoidable causes of cancer after tobacco. Major studies confirm that being overweight or obese increases the risk of various cancers. Researchers estimated that overweight and obesity are behind around 17,000 cases of cancer each year in the UK. 1 in 20 UK cancers are linked to weight. Alcohol causes 7 types of cancer, including breast, mouth, and bowel cancer. every year, alcohol causes 4% of the cancers in the UK, which is around 1,200,000 cases. A study published that 5.3 million of the 57 million deaths worldwide in 2008 were down to physical inactivity. Around 3,400 cases of cancer in the UK each year could be prevented by keeping active. So we decided to raise cancer awareness by selling cookie that has a fact about cookie on the front of the paper bag to the students.